We will discuss the management of open bite. Open bite is defined as the lack of vertical overlap between maxillary and mandibular teeth in centric occlusion. It can be anterior or posterior, unilateral or bilateral. It can be dental or skeletal. This is the skeletal and this is the dental. It is usually caused by oral habits such as thumb sucking, digit sucking, tongue thrusting, and mouth breathing. But the posterior open bite is usually caused by ankylosed or submerged posterior teeth or lateral tongue thrusting habit. The effect of the habits on the anterior open bite is that for the thumb digit sucking, the abnormal pressure that the thumb has will make forward displacement of the premaxilla, narrowing the maxillary arch and proclinates the maxillary anteriors. For the anterior tongue thrusting habit, it causes proclination of upper anterior teeth. The mouth breathing is that the lack of air in entering the nasopharyngeal space will cause a lack of development of the premaxilla, leading to upper anterior open bite and maxillary maxilla constriction. For the increased tongue size, also it causes some exerting pressure on the lingual surfaces of the upper anterior. Some abnormal growth patterns of the maxilla and mandible can cause the open bite, anterior one. For example, the counterclockwise rotation of the maxilla or the clockwise rotation of the mandible, or if we have both the counterclockwise rotation of the maxilla and the clockwise rotation of the mandible. The intraoral features is the narrow maxillary arch and excessive gingival display. Now let's discuss the treatment. For the anterior open bite, we can use fixed appliances to do an intrusion of the posterior teeth to permit counterclockwise rotation of the mandible, and do extrusion of the anterior teeth to compensate for the open bite. We use for this what is called box elastics for extrusion, and they are attached to the 4 canine teeth. This will cause extrusion of the anteriors and closing the anterior open and bite. This method cannot be used for skeletal anterior open bite. For the skeletal, we can be successfully treated during the growth period using Frankel or modified activator appliances, where posterior bite blocks are incorporated with these appliances to cause intrusion of the maxillary and mandibular posterior teeth. Orthopedic appliances like the chin cup with a vertical pull head cap can be used for skeletal anterior open bite to cause clockwise rotation of the mandible during the mixed dentition period. The surgical correction is indicated when we exceed the growth period, where we use Le Fort osteotomy of the maxilla, and if the cause is due to oral habit, we use habit breaking appliance. Now, how can we treat the posterior open bite? As we said, it can be unilateral or bilateral. We said that there are two types of causes, whether it is the lateral tongue thrusting habit, so we can remove it using habit breaking appliances. Then we follow it with fixed or moving orthodontic appliances. If we have a posterior open bite due to ankylosed or submerged teeth, it can be corrected by forced extrusion of the antagonistic teeth using fixed orthodontic appliance, or by restoring the normal occlusal level using crowns. The skeletal open bite in growing patients can be treated using functional appliances such as the bionator or Frankel appliance to correct the developmental pattern of the mandible. And in a non-growing patient, we tend to go for the orthognathic surgery approach. That's it.